the issue around the person, because of the categorical approach in the DSM-3 and the DSM-4, we were more inclined to treat the behaviors that were being demonstrated. So, for instance, if I had an individual who demonstrated behaviors associated with the borderline personality disorder, and they met 5 of the 8 criteria, so they did qualify for that disorder, my inclination could possibly be to treat those behaviors, focus on those behaviors. Mm-hmm. And I certainly don't want to sit here and be critical of your behavioral paradigms, but what we do know from that is that many of those approaches, based upon behavior, resulted in eventual relapse. Mm-hmm. What we're seeing right now in the DSM-5, from my perspective, is a much more psychodynamic approach. That we don't focus necessarily on the behaviors. We focus on the person. We don't diagnose behaviors. We don't treat behaviors. We diagnose behaviors. We treat the person. And we treat the person in a holistic fashion. Getting to recognize that many of these behaviors that they are currently engaged in are purposeful behaviors. They are designed to alleviate some type of psychological, psychiatric, environmental pain in their lives, and that's what we address. That's what we address. And the DSM-5, for the first time, gives us some guidelines into recognizing the purposefulness of those behaviors, that we just don't focus on, for instance, cocaine use disorder. We want to respect the fact that that cocaine use might be a purposeful behavior as it's designed to give that person relief from another issue. And the DSM is going to do that. The DSM-5 is going to do that in every single diagnosis under a paragraph called the functional consequences of this diagnosis. And the reader's going to see that paragraph after every single diagnosis, the functional consequences. What does this diagnosis do to people? And we're going to be encouraged to read that paragraph very closely, where the DSM-5 is going to say to us, this diagnosis in these folks is oftentimes very helpful. It can be impairing, but they do it for a reason.
Okay.
And that's a major issue.